My name is Helen Duggan. I'm clinical lead occupational therapist for cardiac services. My job is very varied, which is what I really enjoy. I work across all of the cardiac wards in the cardiac centre, support patients in the community post-cardiac event, and also help cover the cardiac rehab classes that we run. We run 2 heart programmes in the community, heart failure and regular rehab, so we input into all of those and also to the wards. Occupational therapy was always something when I was at school and sort of 6th form really, that drew me in because of the variety of the role. It's very varied, that you can work with people from children all the way through to the elderly, and also in so many settings. I've been an occupational therapist now for 18 years and I still love my job because no day is the same. I never know what to expect when I come into work, and I think for me that's a real draw. Working in cardiac care, I think what's most important for me is that we get to support patients through the whole journey, right from admission, which sometimes is unexpected, sometimes it is a planned admission, but working through rehab, we can see patients through that whole process, on the ward, when they go home, support them in the community, and then getting them onto the programme. And for me, it's so rewarding to see the difference that we can make, helping people get the confidence, independence, quality of life back and regain what's important to them. I think for us, our unique selling point is obviously we do use occupation as a way of assessing our patients, and people often think occupation, how does that fit in hospital? But for me, it's about finding purposeful activity, what's important to that patient, what will they need to do when they return home. So identifying with them their roles, their quality of life, what they need to regain for them and what's important. But I also feel that as occupational therapists we're very holistic, so we look at the whole person approach, making sure when that person comes in with that cardiac illness, we don't just look at the physical element, we'll look at the impact that's had physically, emotionally, socially, cognitively, and again for some people spirituality, because we are aware that with our cardiac patients, end of life is a conversation we need to be having with them as well. I feel as a clinical lead I always feel responsible to look at driving our service forward, and in cardiac care there is ever advancing changes, and also our population, patient group is changing every day, patients are surviving, patients are living longer, so there are advances in cardiac care. I feel for us the big thing that I'd like to work more closely with is looking at the patients who are surviving post-hospital arrest and looking at their recovery and the part that we as occupational therapists can play in helping them regain and relearn their lives, because some of them recover physically very well, but cognitively the whole world's blown, and I think that's a part that we can really play in supporting patients emotionally, cognitively, getting them back to what they need to do. And like I've already said, for me, I really like to be involved in service development, and I think what's important is that allied health professionals, physios, occupational therapists, speech therapy are all actively involved in development of care pathways. So rather than us being an afterthought, perhaps occupational therapists being considered at the earlier point, looking at the difference we can make. Even when it's a planned procedure, there always the risk of complications, but again, as professionals we should be looking at that holistic whole person and making sure that when people come into hospital we consider them and the families, and I do feel that occupational therapists can play such a valuable part in a patient's care.